welcome to the Inner Circle Boardroom's Backstage Pass. Our objective with this channel is to create content that informs and educates. I'll bring you special guests like I have here today, the former group CEO for a global healthcare provider. The idea of the conversation is to talk about the healthcare sector. Not only are we going to be looking at the gaps, but also the opportunities. I really wanted to focus in on a country that had a very large population when you compare it to something like the UK. I found one which we could not contest against, that has 1.3 billion people, 29 states. I'm sure you can guess it. It's not China, it's India. So with that said, I am delighted to have Hemraj Parmar here with us today. For the sake of our audience, could you give us a bit of an introduction of who you are and a bit about you?
Hello everyone, it's a pleasure to be here. Thank you for inviting me for this amazing show. I have spent almost 23 and a half years in the Indian Army before taking a voluntary retirement. I took premature retirement as a colonel. I commanded an army unit. I've also been part of the Army Aviation Corps, wherein I have done fixed wing as well as rotary wing or helicopter flying. After quitting the army, I went to one of the top business schools. Thereafter, I've had an exceptional track record in the healthcare industry. And as part of that, I've also been the group CEO of BR Life as my last assignment. So we had a chain of hospitals pan India. We were looking to expand globally. And healthcare always fascinated me. Firstly, it is the biggest industry globally. Secondly, because in the army also, I was looking after 38 clinics which were operating over the 6 states in India, and a budget of almost $100 million. Mm-hmm. And then I was also responsible for expanding this scheme to 22 new clinics. Mm-hmm. So that whetted my appetite into the healthcare industry. And once I passed out of the business school, I joined a healthcare company, which was a health hospital management company, and then obviously many more companies later in life. I also had a short stint in Nigeria. Excellent opportunity to work in a multicultural environment. And then I've been the E&L head of these large hospital chains. Currently, I'm co-founding a connected health initiative with some other very well distinguished entrepreneurs with a exceptionally good track record.
That's a fascinating journey. I also know that you've authored a couple of books as well.
That's my first fictional novel, which went on sale on Amazon recently. Yeah. And it's been also one of the best-selling books on Amazon.
Fantastic. And we want to talk a bit more about that. But before we do, let's talk about India and the healthcare system. For those of us that are not really aware, how does the Indian healthcare system actually work compared to somewhere like the UK?
So let me put things in the right perspective. The healthcare is the biggest industry globally with a size of more than $10 trillion. And US healthcare industry is almost $3 trillion size. They spend almost 18% of their GDP on healthcare. Back home in India, we have almost the healthcare industry size of $160 to $180 billion. The size of the industry is likely to increase to $372 billion by 2025. India is one of the fastest growing economies. It's a $3.2 trillion economy today. Unfortunately, our spend on healthcare is less than 5%, 4.7% to be precise. Of that, the government spends just about 1.15%, and the rest of the expenditure comes from the private players. In India, the healthcare penetration, insurance penetration is very low. It is less than 25% vis-a-vis the advanced healthcare markets, which are more than 90%. The out-of-pocket expenditure on healthcare is very high as a result. It's almost close to 70% in India. The per capita expenditure is very low. We have a lot of challenges with respect to the infrastructure in India. 70% of the country resides in rural areas. whereas the healthcare delivery in the bigger cities is almost twice as much as that in the rural areas or tier 3 4 towns. So really speaking, today the challenge lies in taking healthcare to the last mile. Recently the government of India came up with a path breaking initiative called as Ayushman Bharat, which promises to cover almost 500 million people. So in a country of 1.38 billion people, almost 500 million are likely to be covered through this scheme. And this scheme would also form the base for universal health coverage in the coming years. And gradually, we are also inching towards value based care, what is already prevailing in some of the advanced economies. So, we have a very robust system of accreditation. Some of the hospitals which are being empaneled for Ayushman Bharat would be NABH accredited, which is the gold standard in terms of quality in the country. There are close to 1,000 hospitals already which are NABH accredited in India. We also have JCI accredited hospitals, close to 30 plus, but in due course of time, more would come up. So the government is going to patronize the hospitals which offer very high quality treatment at affordable costs, which is safe and accessible. Unfortunately, today, the challenge is in taking the healthcare delivery to the rural areas. And as part of that initiative, the government is going to increase its expenditure on healthcare from the current 1.15% to almost 2.5% by 2025. As you are aware, India is the fifth largest economy in terms of PPP. We are third, but our healthcare expenditure and other indicators currently are abysmal. We currently have almost 2 million beds in the country, almost a million short of what is desirable. We have almost shortage of 2 million nurses, almost a million beds, and a large number of other infrastructural and manpower related shortages, which we need to bridge in, in the interest of taking this healthcare delivery to the needy people who currently do not have that access to quality healthcare right now. So currently, if you see the demographic statistics, more than 50% of the Indian population is less than 25 years of age. And almost 65% people are less than 35 years of age. So India today is one of the youngest.
Yeah.
When we look at the other advanced economies like the US or Japan, they have an aging population. So the disease burden is also a little more. But one major problem that we are currently grappling with is the dual disease burden. While we have the traditional, communicable diseases going on, which are still a problem across the country, especially in the rural areas, we are also encountering a new problem, which is the lifestyle disease related healthcare problems, hypertension, diabetes, and so many other problems. If you look at the healthcare statistics, they are alarming. So, out of 10 people, 10 deaths in the country, almost 7 people are dying of non communicable diseases. So, that's a huge problem. And the government has to take the initiative to spruce up the infrastructure. They have to create conditions conducive to fresh investment. Thankfully, the private healthcare providers have risen to the occasion and they command a large portion of the healthcare delivery, high quality delivery, which is currently taking place in the country. So 80% of the doctors are today operating in the private hospitals, whereas the proportion of beds in the public facilities is much larger, which essentially means that while the public hospitals command more number of beds, the availability of super specialists is extremely low.
Yeah.
And that's where the private industry is actually bridging the gap. There are a lot of investors ready to invest in India. And if the government creates conducive environment for investment in the coming years, one would see a drastic improvement in the infrastructure.
Do you see a lot of barriers to entry for new players who want to come into India?
The barriers of two types. One is tariff, and the other is non-tariff. So last year, the National Pharmaceutical Pricing Authority came up with certain caps on the stents and other implants which are used in the hospital for treatment of the patients. So after those caps were put, the hospitals and the other healthcare providers faced major challenges in terms of treating the patients, because the prices which have been put on these implants and stents absolutely low, and they are actually lower than the cost of these products in the market. And this also became one of the issues with the trade representative of the US who came and visited India, and this was one of his major reasons. A lot of pharmaceutical companies and these medical devices company refused to provide these implants and stents, and there was a pricing cap on more than 1400 drugs as well, which becomes very unrealistic if the healthcare providers have to stay profitable,
Yeah.
and viable business entities, then obviously the pricing has to be left to them while retaining certain provisions in terms of quality. Today, this is one of the challenges being faced by the healthcare providers. While there is a cap on the certain treatments and these medical devices and consumables, the profitability is dwindling at an alarming rate.
Yeah.
And if we pick up the results, the financial results of some of the publicly listed companies, there is a huge dent on their EBITDA margins and overall profitability. So if you see, the healthcare industry is by nature a capital intensive industry.
Yeah.
All the costs are front loaded. You cannot start a hospital without MRI, CT, linear accelerator, or other high end devices. And the fixed expenses are extremely high. If we look at the medical devices, almost 70% today of the medical devices are being imported in India at extremely high rates. China is slowly entering the medical devices market, but most of the equipment either come from the US, Germany, and other European countries. China is definitely a late entrant into this market and is rapidly capturing the market. In Africa, for example, they are one of the biggest players because of the cost advantage. And they are also catching up on the quality front pretty quickly as well. More than 50% of the generics are produced in India. The US major supplier to UK is India. And now with the COVID vaccine also around the corner, India is going to emerge as one of the largest producers of COVID vaccine. In any case, we have cornered more than 50% of the market for the vaccines across the globe. And with the accelerated NDA coming in force, more and more generic drugs are going to be available for production in India.
Yeah.
And the exports are likely to boom much beyond where they currently are. The government of India, has launched an initiative called as Make in India. So under this initiative, large number of industries are being patronized: defense production, healthcare, medical devices, biotechnology firms, manufacturing of other engineering goods. India is also incidentally exporting some of the medical devices. Almost $2 billion worth of medical devices have been exported last year, while we are importing the medical devices is almost an $11 billion market. Last year, we imported equipment. The procurement was almost $11 billion, of which almost 70% was, imported.
Mm-hmm.
But we exported $2 billion.
Yeah.
So in case we have to meet the ends of universal health coverage and taking the healthcare delivery to the masses, then we need to produce medical devices, more pharmaceutical products which are higher end, and also the other allied healthcare products such as consumables and implants and things within India to optimize on costs. And this cost can then be passed on to the patient.
In your opinion, how do you think that India responded to the challenge?
This has become a global problem now. Almost 5 to 6 billion people are already affected by COVID. In case of India, this problem is actually more acute. Our economy is going to contract by almost 23.9%. And if we can see, most of the countries were not really well prepared. They did not have the capacity for taking care of the critical patients. There was no national policy in place. There was panic all around. We did not have adequately trained healthcare providers, doctors, clinicians, technical staff. We did not have adequate ventilators. So there was a panic initially before the world could fathom the actual impact of this pandemic. And then India slowly started opening its economy. So first 2 quarters of the current financial year were totally washed out as far as the businesses were concerned. So the hospital businesses also went down to as much as 25 to 30% of their pre-COVID top line, which now slowly is bouncing back and recovering. Healthcare is one of the recession-proof industries. But unfortunately, since the pandemic hit, the providers also, and in a bigger way, the patients had that, lingering doubt or fear of infection while visiting the hospital. So a lot of elective surgeries were put off, which amount to millions of surgeries and consequently billions of dollars worth of revenues, which was lost.
Yeah.
Similarly, India is also one of the major players in medical value travel. The size of the market is anything between $3 and $6 billion. We were getting a lot of patients from Africa, Middle East, and some of the SAARC countries. And that flow of the patients has stopped, which also contributed significantly to the top line of some of these healthcare providers. So because of the lower revenues, most of the healthcare providers have faced major problems in working capital management. See, today in the hospitals, the working capital available is not more than 1 month, 20 to 25 days to be precise. Pandemic lasting such a long time, and the business recovery taking such a long time, almost, we are in the close to third quarter. The hospitals have just been able to recover to 45 to 50, 55% of their pre-COVID revenue, which is not even adequate to pay their manpower, vendors, and the other business partners who are supplying you all the consumable drugs and implants.
Mm-hmm.
So one, the policy needs to be worked out at the national level to deal with such pandemics. We need to create capacity in terms of critical care, in terms of trained staff to deal with such pandemics, and also invest adequately to manage such a criticality at short period of time.
So let's just go back to cash management. How does a hospital then continue through a lockdown to be sustainable?
Yes, Kay, very good question. Unfortunately, most of the hospitals, especially the smaller hospitals, do not have the wherewithal to last this kind of a cash crunch for many, many months together.
Yeah.
So hospitals typically, have their business structure in such a way that 70% of the business is cash patient driven and 30% is credit business. Typically, I'm talking about a multi-super specialty hospital in a bigger city.
Mm-hmm.
It would have about 70% walk-in patients who come and pay in cash, so that cash is readily available to meet your working capital requirements. But 30% is through the credit business, with typically the insurance companies, which we call as third-party administrators in India, HMOs in some of the other markets. Then also some of the private and public corporates. So patient would come in a cashless treatment, take treatment from the hospital, go back. We are required to submit the bills, and the money will come after a few months. Typically, it can take anything from 90 to 120 days to realize that money. And at times, there are deductions from that, anything from 5 to 10%. So it's a major problem. You lose your 30% of revenue until 3 to 4 months later, and you have a pandemic in which you are not generating enough through your cash paying patients. So most of the hospitals have gone either on cost optimization initiatives, which essentially meant taking a hit on your salary, and also in certain instances reducing some of the outsourced services and optimizing on your existing teams. In the absence of which it would be extremely difficult to stay viable, and also to meet whatever shortfalls are there, take additional debt from the banks to keep your operations going.
Moving forward, are we going to see closures of hospitals?
In the current quarter, there are green shoots. There is a recovery, and slowly there is definitely a progress. Obviously, the patient cannot stay too long away from the hospital and keep postponing those elective surgeries. They have to undergo coronary bypass surgery if it is a requirement, and if it is going to have an adverse impact on the patient's health. So far we have been treating only emergency cases, but slowly the patient has started coming back. That initial panic or fear of contracting this disease has gone out of the minds of the treatment seekers, and patients are again coming back to the hospitals. So revenues are also slowly bouncing back, and we hope that by the end of the next year we would be somewhere closer to pre-COVID revenues. Till then, you have to manage. Obviously, there are certain business entities which will go out of business for sure, and we are going to see a lot of consolidation also in the coming months and years.
India is very known for being cost effective around health and wellness. You get a lot of Westerners who go to India to do alternative kinds of medicine. Some of these businesses are smaller businesses, and I can only imagine this is going to be an impact on them as well, not having the customer come through the doors. Because of COVID, everyone's been locked up. There are people who have got cancer and need other surgical treatment. Those have been put on hold, which then escalates further issues in those patients, and actually that puts more pressure on the system.
Absolutely. There are certain criticalities which cannot be put off. There is only a limited window wherein the patient has to undergo that treatment to stay healthy. Otherwise, there is a likelihood of complications. The clinical condition may worsen. Obviously, the productivity will go down, quality of life will go down, and the patient has to come back to a healthcare facility to seek the treatment which is desirable. A lot of patients have actually in this duration suffered healthcare risks because they could not visit a healthcare facility because of the lockdown. So there have been a lot of fatalities also. There is only a limited time to which you could postpone critical treatments. Thereafter, the risk to life would be huge.
I know that you've just founded a startup. Tell us about the gaps and the opportunities that you see.
India is one of the fastest growing economies. We have a population of 1.38 billion people. Just 25% are insured, the rest are not. There are a large number of initiatives, new business models, which are getting evolved and executed across the country. So obviously, there have to be certain rural health initiatives. Telehealth is one initiative, which is proving to be extremely useful because the patient cannot come to a healthcare facility. Obviously, you have to take the healthcare to the patient's doorstep. And there is a huge revolution taking place in the digital arena in India. We have a mobile subscriber base of 1.2 billion people. The internet access is more than 35% in the country. More than 60 to 70% people have access to smartphones. So this is not as if 10 years back that we could not reach to the patient who was in a far-flung area. Today, technology enables us to take the healthcare delivery to the doorstep of the patient. There are a large number of companies which are coming up which cater to the rural health. Smaller retail health clinics are coming up which cater to primary healthcare requirements. See, even in the last budget, the government of India has given a big fillip to wellness. As part of the budget they have declared, as part of Ayushman Bharat, the government of India is going to establish more than 150,000 wellness clinics across the country. Because today, mental health and preventive health are emerging areas which definitely require a lot of fillip, a lot of support, a lot of capacity building across the country. So far, we were never so proactive about preventive medicine. We were never very conscious of mental health. And these are some of the issues which can be taken care of early in life so that a patient's life can be prolonged, quality of life is prolonged, and they can lead a healthy life. There are a lot of startups which are coming to fill that gap. There are a lot of companies which are dealing in telehealth, in telemedicine. Incidentally, in telemedicine, the consultations have gone up dramatically during the lockdown, almost 500 to 600%. Pre-COVID, there was a reluctance to actually be seen by a top super specialist, by a patient, because in India, the consumer or patient psychodynamics are such that the patient loves the touch and feel of a doctor. Unfortunately, being forced by COVID because of the fear of infection, now the willingness to be seen by a doctor sitting hundreds of miles away has increased dramatically. Similarly, on part of the physician also, there is a willingness to see more patients. They see value in consulting a patient over the digital platforms. So on the patient side, in that clinic, you have a setup which have IoT devices or IOMT devices connected on the net with a doctor who is sitting in a multi-super specialty hospital. And with those IoT devices, the clinician can actually get to know the clinical condition of the patient in the real time frame. This inspires confidence in the patient. So large number of healthcare initiatives are coming up which are providing that kind of connected health support. There are home healthcare companies which are providing support to the patient in the patient's home. And frankly, if you look at the emerging trends, then the patient actually will not need to come to a hospital in future because most of the healthcare delivery can be provided remotely. In the some of the hospital groups in India have gone for remote care, management of the critical care remotely from a command center, from where you can actually monitor multiple units simultaneously connected on the IoT based devices. You can see the patient condition, clinical condition in the real time frame. So this, while being able to provide very high quality treatment to the patient, also dramatically brings down the costs.
Yeah.
Now this also can be taken to some of the rural areas. And some of the state governments have actually tied up with some of the private providers on a public-private partnership basis. There are e-clinics, being e-health clinics, which are being operated by some of the bigger players. There are a lot of other companies which are coming into this domain, which will help take the healthcare super specialty, especially treatment to the patients which are currently not privileged enough to get that kind of attention. Technology is the main driver. The government itself is turning into a payer. Ayushman Bharat basically is what? The government is ready to pay the patient. The patient can avail of cashless treatment in a multi super specialty hospital, which is empaneled with the scheme, and they are then ready to pay the provider for whatever treatment is provided to the insured patient. Currently, we have a large amount of population which is very vulnerable. They have to pay the treatment costs out of their own pocket, and sometimes it can be absolutely devastating. A lung transplant, transplant, or a kidney transplant can set you back by anything up to 3 million rupees. And sometimes there are patients who have to undergo emergent treatment for organ transplants. And this can lead to bankruptcies also. Major issue.
I suppose I see opportunities there for insurance companies because they've still got 75% of the market to go for. But then it becomes a matter of affordability. And some people don't think long term, they only think short term.
The 75% or more than 70% who are currently paying out of pocket obviously have to find somebody who would like to pay for that treatment.
Sure. Yeah.
And therein lies a huge opportunity for the private sector. See, the government can provide certain, there are a lot of state governments in India which is going for public-private partnerships.
Yeah.
They are giving land at subsidized rates. They are also ready to do loss funding. They are ready to contribute additional money till you break even, and make sure that you bid for those healthcare projects which will take healthcare delivery to the last mile.
Mm-hmm.
But today, because the government policies are such that providers fear that bureaucratic interference or systemic inefficiencies which have to be taken care of by the governments, both at the state governments and at the national level, the private healthcare industry needs to be incentivized in a much bigger way, so that while providing this healthcare delivery, they also can make modest returns on their investments. Unfortunately, today this is very, very challenging. There are a lot of state governments which have come up with diagnostic centers, which have come up with some hospitals which are working on a public private partnership. There is a slow increase in the momentum, but I think a lot more needs to be done. The healthcare providers have to be incentivized. The atmosphere has to be made more conducive for investment, both from within India and also for the international investors who might like to come to India. India is a big story globally, one of the fastest growing economies. Are you in India? No. Then obviously there is something you're losing. Yeah. Obviously, it's a land of opportunity. 70% of the population is still not covered with insurance. We need to provide them very high quality, affordable treatment. How do you do it? I mean, the government itself cannot do it. It needs the support of the private players.
Yeah.
And that's where all the high quality treatment is coming through the private players. We need to build the required infrastructure in terms of bed capacity, in terms of clinical excellence, by producing more doctors, more nurses, more technical staff, producing medical devices, equipment indigenously. A lot of high-end drugs which are currently being imported, we need to produce locally, so that the affordability can be ensured to the advantage of the government organizations as well as for the private healthcare providers. First challenge is really in making a success of the Ayushman Bharat task of providing healthcare to 500 million people is really a gargantuan task for the government of India. Part of this initiative, the government of India has set a limit for treatments up to 500,000 rupees to almost 500 million people across the country. And in due course of time, Government of India is also looking at universal health coverage to turn as a payer instead of a provider. We have a large number of government hospitals across the country. Unfortunately, they are not very well managed. There is no clinical excellence. There is no adequacy of infrastructure available in these facilities, and they are poorly managed. Also, they lack in very good quality of doctors. So while they are good enough for primary and secondary care, they lack the infrastructure for quaternary care and tertiary care. So this gap is likely to be filled up by the private providers. So one challenge is to meet the ends of Ayushman Bharat, which aims to be a path-breaking solution for especially the poorer sections of society in the country, and then also carry forward the scheme to everybody in the country. You pay some kind of insurance, and then you can avail of that treatment, which can be affordable. And obviously, like in other advanced countries, the younger will pay for the seniors who might actually require that treatment more than the younger population. That's how the having a younger population in India would help. So also driving the public-private partnership, which is really the way forward. Even the government hospitals, there our suggestions should be converted into medical colleges to make up for that shortfall in trained manpower, in trained doctors, the shortfall which we currently have. And also open the doors for foreign investment and also investment from the private industry. Give them a lot of incentives to set up these facilities wherever there is loss funding. Typically, a healthcare facility would break even. Multi-super specialty hospital in a bigger city would break even in 3 to 4 years if it is extremely well managed. A not so well managed unit might take much longer. So if the provider is not going to see value in his investment or support, financial support from the state government or from the central government, they would hesitate to make those kind of investments in rural areas where the paying capacities are extremely low. Today, there are more than 1,400 treatments packages which have come out as part of the Ayushman Bharat, and their rates are actually a fraction of what a walk-in or cash-paying patient would pay. So that cost really doesn't stack up for a private provider, because your input cost is much higher than what is being paid to you. So today there is a hesitation in accepting an Ayushman Bharat patient. At best, this patient can be used to utilize your spare capacity. In India today, bed capacity utilization across the country is between 50 and 60%. That means there is still 30 to 40% capacity which is unutilized. Unfortunately, this unutilized capacity is in bigger cities where the requirement is lower. You have the need more in the rural areas, in the far-flung areas where currently, good hospitals are not available. So to take healthcare delivery to those areas, you need investment.
Yeah.
Government cannot make that investment. They don't have that expertise. They don't have that capacity to build those healthcare facilities. Private industry has. If they are incentivized, then definitely they would be happy to set up those units and provide the kind of treatment. Secondly, the rates which have come for Ayushman Bharat are abysmally low, unrealistic. Recently, a study was carried out by the Association of Healthcare Providers of India in conjunction with Indian Institute of Management, Bangalore. The findings were startling. The cost of delivery of a particular treatment in the government facilities is much more than that in a private healthcare facility. And the rates which have come out for Ayushman Bharat scheme are absolutely unrealistic.
Why does it cost more to do it through the NHS there as opposed to going private?
There are systemic inefficiencies. There is overstaffing. The capacity is much more, utilization is much lower. And then there are many other regulatory factors which delay, like the average length of stay in government facilities is much longer than what is there in the private hospitals. The readmission rates, the hospital acquired infection rates, the asset utilization of OTs and other revenue centers in a hospital, bed capacities, everything is low. So you have large number of doctors, but you lack in super specialty treatments. Your infrastructure is much bigger, but you do not have the required super specialists. You do not have that quality of infrastructure which is required in a bigger hospital. Public-private partnership is going to play a major role. And also the government, if it gives right incentives to the private healthcare providers in opening new clinics, new hospitals, new diagnostic centers, new pathological laboratories, new wellness centers, streamlining of the supply chains, reducing dependence on the imports, producing a lot of medical devices, pharmaceutical products indigenously, exporting some of them so that that cost can be passed on, that benefit can be passed on to the patient. That is the way forward to provide very high quality treatment at affordable costs to the masses, which is currently the need of the hour. India is a huge market, 1.38 billion people, and with the ongoing trade war between China and India, a lot of production is going to shift to India, for sure. And India is rolling out red carpet to the businesses, which are interested in moving out of China. Of course, there are other markets like Malaysia, Thailand, Mexico, for example. Mexico, the transit time between Mexico and US is just 1 week. Between China and the US is 30 days. In India, it can be maybe 2 to 3 weeks between the US and India. So while we have the capacity, maybe over the next few years, India would be emerging as one of the manufacturing hubs for sure. There are already large number of companies which have come up and invested in India over the last few months. Although pandemic has been one of the dampeners, but definitely is a positivity which is there in the minds of people because India is a huge market. Secondly, the unrealized potential actually emanates from the fact that healthcare delivery is currently very, very skewed towards bigger cities. So rural areas are still with very, very basic infrastructure. So huge investment is required there. And government is going to come up with a lot of incentives, hopefully in future, to make the atmosphere viable. So in long term, we have very, very positive outlook. But in the short term, driven by this pandemic, obviously people are going to act very cautious. Even the bigger hospital chains in India have put on hold a lot of their expansion projects within and outside the country because still there is a lot of uncertainty. We do not know how the world economy would be 2 years down the line, but definitely it'll take anything up to 2 years to bounce back to normalcy. Obviously, the sentimental then would be kind of muted. I won't say negative in the short term, maybe tilting towards negative, but the long term outlook is definitely positive.
Looking on a macro scale, if you were going to go and invest somewhere, my question is, where would you go and invest right now?
There are a large number of areas where potentially foreign investors could look into. Digital is one space where there is going to be a lot of activity. Connected health, remote care, artificial intelligence, systems which will help delivery of remote care to a patient.
Yeah.
So all these new business models which are currently being incubated in India stand a very good chance of success in connecting the patient from these far-flung areas to bigger hospitals. So all the digital initiatives, all the retail clinics, which cater to wellness, which cater to primary healthcare delivery, which cater to supply of medicines, artificial intelligence, devices connected on IoT, satellite models. These are the ones which are going likely to succeed more. Pathological laboratories which can reach to the last mile. So driven partly by the PPP projects, so that it becomes a win-win situation both for the private player and the government agencies.
Yeah.
So a lot of government agencies, state government agencies are actually, healthcare authorities are laying a lot of emphasis on such initiatives. Obviously, it will come at a cost. And because we have a national-wide shortage of super specialists, then the doctor should be able to provide multiple consultations and treatment to people in different areas sitting in one place. Technology is going to be the driver or the platform on which this care can be delivered. So all those retail clinics which connects a doctor to a patient who is sitting in a tier 3 4 city. So on the clinical side, we would have a clinic set up there, which would be connected with a clinician sitting in a bigger hospital in bigger cities with bigger hospital chains such as Fortis or Artemis or other bigger hospital chains. The patient would be connected over the net with the IoT devices, so that the doctor can consult with the patient in the real time frame.
Yeah, understood.
So the clinic itself would have a medical specialist, fresh pass out, from a medical institution, MBBS and MD, who would be able to facilitate the consultation of this patient with a super specialist, urology, nephrology, or hepatologist, or transplant specialist, or oncologist, something which is currently not available in smaller cities. And then there would be other value added services which the patient can avail of. So the consultation itself would be at a very nominal cost. In a bigger city, the patient may land up paying anything between 1,000 and 2,000 rupees for a super specialist consultation. We would provide that consultation to that patient within 200 rupees, and then of course connect that patient with the diagnostic centers or pharmacies which can ensure delivery of the reports at his home, or on a particular portal from where the patient can download. The patient will get a unique hospital ID, which can be used in any of our centers across the country. We are going to start with one clinic, connected health clinic. It is going to be much more than a telemedicine center. We will start with one clinic and then take it pan India to almost 500 clinics over the next 4 to 5 years. If you look at the current models which are prevailing in the market, in India, most of the telemedicine support which is being provided is kind of a video call. No devices which measure the clinical condition of the patient in real time frame. See, the super specialist can take better clinical decisions if he has the basic body parameters and little advanced. So over the net, imagine a clinician is seeing a patient hundreds of miles away, as if the patient is sitting across the table, connected over the net with these IoT based devices, passing clinical information in real time frame. And we are going to have centers of excellence, let's say for cardiac sciences, because cardiac sciences in India is almost 20% of the market. Diseases which are increasing at a rapid pace. Patients can consult a cardiologist oblique a cardiothoracic surgeon sitting hundreds of miles away. And if the super specialist realizes that the conservative treatment will suffice, then there is no need for the patient to travel to a bigger city, which is very taxing in terms of money and time.
You guys were looking for investors. How are you finding that journey of pitching to investors at the moment?
Response so far, there are a lot of investors from India and outside India who have liked the idea. It's a very, very unique idea. So good response so far. We have reached out to large number of individual investors who are ready to invest. A lot of doctors are ready to invest, HNIs, and some of the institutions have also shown interest, incidentally. So we are going to be very cautious on who we take the money from. We wish to have a proof of concept, which we are very confident of doing it and making a success of it, and thereafter go for series funding.
What sort of numbers have you projected utilization of this?
Numbers we are taking are absolutely conservative figures, and within 4 months we wish to break even. This is after taking very conservative estimates. So there are a large number of initiatives which we have already taken. We've tied up with some of the hospitals who have shown very keen interest, because this is yet another channel of revenue for them, and they have zero investment. The only investment which we are expecting from the hospitals or providers is in terms of the time of the super specialist. So if the patient gets converted, obviously the doctor will get that patient for procedure or higher end treatment, and that's where they make the money. And this is yet another channel of revenue for the providers. Currently they do not have access to this kind of ecosystem. So by the mid of next year we wish to have 50 plus centers, and through this initiative we will have access to almost a population of 1.5 crore, which is about 15 million people. Currently most of the providers do not have this kind of reach or access to the clientele. Straight away it gives you access to that, and that's where the providers are seeing value, and they are very keen to they are ringing us up, when are you starting the clinic.
How did you identify the opportunity?
These co-founders that we have been connected over the last many years. We started with the LinkedIn, and then we have been following each other's journey. Some of them are serial entrepreneurs.
Yeah.
Some of them have scaled up businesses to several $1 million, sold those businesses and come on board. A couple of meetings and discussions later, we have come on board as a team, and this team is extremely strong. We have somebody from one of the co-working space who have scaled up a business to multi-$100 million. Another person who's run number of companies, sold some of those in a very scaled up manner. So these people bring in exceptionally good entrepreneurial experience. They have access to very valuable advice from successful entrepreneurs, and then obviously I will be their healthcare lead to connect them with all the stakeholders in the industry, give them the relevant advice on ground, and make the whole ecosystem work.
So tell me, how did someone who worked in the army, then went into the corporate world, now starting to go into the startup world, and now you're an author of a book, what inspired you to want to write a book?
This beautiful book, Alive Till I Die, this was always on my mind. Conceived this book almost 15 years back. Unfortunately, I could not get the time to pen it down. I've always been an author. I'm a regular blogger. I've been writing for some of the healthcare magazines regularly. And I've also been a panelist and speaker on many occasions of national events of national repute. Because of the pandemic, I did get the time to write this book, which I finished, and I'm already on my next book.
Why did you call it Alive Till I Die?
So this book is about four friends who join the National Defense Academy. They have a lot of interesting tales to tell while undergoing the training in this fantastic cradle of leadership, as we call it. So a lot of interesting things happen when they are on the premises of this training academy, and then they go to their respective arms. One goes to Indian Air Force, two join the army, and one joins the Navy. And then their respective journeys through their professional journeys through their respective arms, and they all come together for a warlike situation, and then they have very commendable performance throughout their careers, and it terminates into kind of denouement through a war in which they all excel. And the naval friend actually joins the corporate world. So through him, I have shown the corporate life, how it works, and what are the pitfalls and joys of working in a corporate world.
How did you transition? What expertise were you able to take from the army into the corporate world?
Army is one institution where there is a structured training for leadership. Right from the beginning, you are given responsibilities in such a manner that there is tremendous, you learn right from the younger years till you grow on top of the food chain. So this is also a very unique organization where you are actually going to lead the men into battlefield, wherein they have to be prepared to lay down their lives if they need be. Unfortunately, in the corporate world, that's not a requirement. Corporate world is profit driven, value creation, and leading your teams towards profitability and building sustainable organizations. Whereas in the armed forces, the accent is on leading by personal example, leading your men into fire. You need to inspire them by your personal example, by your personal bravery, professional competence, so that your followers will follow you into the battle to the extent of even laying down their lives. When I wanted to transition to the corporate world, I thought that going through a business school and understanding the critical nuances of the corporate world would be a welcome step, so as to be able to transition smoothly into the business world driven by value creation and profitability. So for me, that really helped. That experience in a business school was phenomenal. You learn more from each other than what you learn in a classroom. It really helped me settle down in the corporate life. That training really helped me transition very smoothly, and that's one of the reasons for my success. In 7 years I became a CEO, which people take decades to reach. People coming from the military background are highly prized.
Why do leaders get promoted based on particular outcomes that they've achieved, yet they've had no formal training of crisis management? As we know, business is never a straight line. So I never really quite understood why we don't prepare our leaders around crisis planning.
As we say in the army K, that no plan survives the first contact with the enemy. I think that scenario planning in businesses, what we call as risk mitigation in the businesses, the leaders definitely need to be trained in that, and also the crisis management. See, if everything were fine, then the leaders won't be required. Leaders are required to turn around very, very tricky, poor situations into an opportunity. You have to convert a suboptimal situation into an opportunity. And that's what a battlefield, we talk of fog of war, when bullets are flying, artillery shells are falling, there is smoke all around, your communications are broken down, you do not have contact with your leader from whom you take instructions. So in those situations, you should be able to take your own decisions. How the situation will play out, you have your ear to the ground and should be able to efficiently manage that situation. That training of mine has actually helped me tide over many, many tricky situations in the business world. And many a time, my team members have told, you look very cool. I mean, people are panicky, they are running around, and there is a crisis situation in the hospital or in the company, and you are composed, because what your team will be, they actually see you first, and accordingly that energy of positivity gets passed down. Optimism flows from the top to your team, whether it's motivation, it's integrity, it's kind of commitment 24/7. You are that torch bearer, you are the fountainhead which drives that team. And that crisis management actually is a skill which the armed forces give you in ample supply.
The number of businesses that have leaders that are probably not well prepared around crisis management, I suspect that's going to be a large proportion.
Pandemic is a global crisis. Situation is absolutely, we would call as fog of war. When you're in contact with the enemy, similar situation is prevailing in the businesses.
Yeah.
Your revenues are not stacking up. People are likely to lose their jobs. Their mental health is adversely impacted. You have more patients to handle who have suffered in the pandemic than you were prepared for. Shortfall of everything, shortages of your medical devices, shortages of your working capital, pharmaceutical products, your vendors not ready to supply you, your drug implants and consumables. This has created a very huge problem for the businesses globally. I think the leaderships have never been tested more than this, crisis situation globally. And this is where you actually see the true worth of leaders who have mental resilience, who can stand up and lead those teams in this crisis situation, motivate them, and also goad them to work in a very productive manner.
I'd like to say thank you for joining me here today. And I look forward to having more conversations with you. If you enjoyed that, please subscribe to the channel. We're going to be doing loads of interviews like the one you've just seen today. And we'll see you on the next recording. Thank you. Bye-bye.
Thank you so much, Kay. It's been a pleasure speaking with you.
And
Thank
it's
you.
been an absolute pleasure speaking to you too. So thank you for taking time out to speak with us.